Of course, here on the Morning Blend, we like to talk about all different age groups, and especially we like to share some love with the seniors, and we are not alone. In fact, MyCare Medical Group does just that in this very important time of enrollment right now. We love to check in with our friend James. Good morning, James. Good to see you.
Good to see you, Natalie. Thank you.
So it is such an important time, of course. We're talking about open enrollment right now, which ends December 7th. And at MyCare Medical Group, of course, there's a focus talking about Medicare and helping people get the details that they need. Sometimes you hear that term, but I don't know if people necessarily understand what it is, especially if they're not in that age group yet. So let's go back to the basics, if you will. When it comes to MyCare Medical, how are you able to focus on the seniors?
Sure. This day and age, the thing that you have to be aware of, the seniors have access now to a lot more information than they ever have in the past. They are independent for longer periods of time, and their caregivers have access to more information. So what we're doing is we're making sure that we take the time to address any questions, link what we're doing in terms of their care to what they're seeing on TV, because they have questions about those things. Sometimes they're curious, or information that they've gathered from the internet. Those are all relevant questions that in the past, seniors didn't have access to. But you now need to spend time to make sure the connections and those linkages make sense for the senior so that they can help make informed decisions about their health along with the doctor.
Speaking of informed decisions, some seniors choose to stay at home, and maybe they think that, well, you know what, MyCare Medical Group's not going to be able to help me. I don't want to leave the house. That couldn't be further from the truth, right?
No, that absolutely correct. A lot of diseases require surveillance and maintenance, and you need to actually come in to see the PCP. I mean, that is vitally important because you don't want that disease or that condition to get out of control. And so we have very active COVID protocols that we adhere to, and we're available 24/7. We have instant appointments. In fact, if you think you have COVID, we will even come out to your car and check and screen you at your car, so you don't have to come into the center and have that concern. So, if you're looking at this footage right now, that's Dr. Patel. That's obviously before the COVID protocol, but he's actively engaging with one of our patients right now. And so that's what we do. That's how we take care of our patients.
Oh, we're such a fan of Dr. Patel, too. It's good seeing him there working in his environment. He's usually in our environment. And you can tell working with the patients there, it seems like a pleasant experience. And I know patient care and, of course, their experience is just as important. Explain how that is so important and why that satisfaction is so key in how MyCare Medical is set up.
Well, it's so interesting. A previous scene that you were showing was the staff actually having a huddle to talk about the patients that are coming in and how they're going to give them excellent care and treatment and how important patient satisfaction is. And so we actively talk about it on a daily basis. In fact, there's a huddle every day. And one of the topics of conversation every day is about patient satisfaction and how we're going to make sure that the patients that come in and out of our centers have a great experience.
I love that. It's like sports. There's a huddle every day. There's the pregame locker room speech every day. Is that what you're saying, James?
That's exactly correct. It's not only with the staff, it's with the doctors as well. And it's like, what is the game plan for today? Yes. How are we going to make the patients feel great?
I love it. Well, you know what? In closing, of course, people watching this, they want to know, okay, well, how do I become a patient? Are you taking new patients?
Oh, yes, of course we're taking new patients. Yes, come on out. In fact, you can visit any of our centers. You can call the number on the bottom of your screen. You can visit our website, make an appointment. We are going to be at the Ark of Hudson, and we're going to have a food pantry event sponsored by Humana on the 8th of December. And it's going to be at 12052 US Highway, US 19 in Bayonet Point, Florida. The Ark of Hudson. It's a food pantry. Come on out. You'll meet the doctors, you'll meet the staff, and you'll have a chance to tour the facility if you'd like.
I love hearing that. You're so passionate about giving back to the community, but of course the focus on the seniors too when it comes to the MyCare Medical Group. James, it's always a treat to see you, buddy.
Same here, Natalie. Thank you very much.
Take care.
Happy Thanksgiving.